Hi, I'm Dr. Sunil Kumar K, Lead and Senior Consultant, Aster CMI Hospital. Now, the topic for today's discussion is pneumonia. Pneumonia is also defined as inflammation condition of the lung, primarily affecting the small airways and air sac. Now, lungs are such a wonderful organs. The main trachea divides more than 23 times before ending into a sac called alveoli. Now, each and every alveoli is covered with the blood vessels. Now, whatever the atmosphere air goes into the alveoli, that delivers oxygen into the RBC of the blood vessels adjoining. This is a normal functioning of the lungs. Now, because of the pneumonia, because of some infectious etiology or a non-infectious etiology, there will be hypersecretion of a mucus and a fluid in this particular sac, hampering the oxygenation diffusion across the alveolo-capillary membrane, presenting with as a pneumonia. Now, if you see the burden, it is alarming to see more than 450 million cases have been documented globally, with accounting for more than 7% of population, with around a staggering 4 million deaths per year. And it's contributing to one of the leading cause of death in ICU. Now, each and every year on 12th of November, we celebrate World Pneumonia Day. Theme for 2023, championing the fight to stop pneumonia. What are the key points? What is that is offered in this particular Pneumonia Day? Raising the awareness about pneumonia, promoting interventions to guard against, prevent and treat pneumonia, generate action plan to combat the disease called pneumonia. What are the causes of pneumonia? Predominantly it is a bacterial cause, viral causes, fungal, parasite. Of late from 2022, we are seeing COVID, which has brought the whole world down to their knees in terms of pneumonia getting more scary. What are the different classification types we need to know about pneumonia? Divided into majorly typical and atypical. Typical generally present with fever, cough, breathing difficulty. At the same time, atypical most commonly acellular organisms like Mycoplasma, Legionella. Predominantly, there is a disproportion with the symptoms and the signs what we see on an X-ray. One more classification of CAP, or nothing but community-acquired pneumonia, or hospital-acquired pneumonia, including ventilator-associated pneumonia. Now, when it comes to community-acquired pneumonia, we have Streptococcus pneumonia as a predominant cause for pneumonia, and at the same time, X-ray shows a lobar consolidation. Most commonly, patient with pneumonia present with fever, cough, breathing difficulty. Depends on the age, depends on the comorbid condition what the patient underlying has. And at the same time, the parameter which just oxygenation at the emergency level, whether the patient needs hospitalization or can be comfortably managed at home. And other parameters like investigation like X-ray and ABG comes up handy in terms of making this decision much easier. There are two scorings which comes up very handy in terms of dissecting whether the patient need ward care or a ICU care or a home care. Basically, two scorings are 𝐁𝐬 65 and a pneumonia severity index. Now, at the emergency level, any patient with this or symptoms do send up for a cultures, which will be a key things to determine whether which antibodies has to be started earlier to get these things sorted. To zip through the whole things, we have a diagnostic molecular test which comes up handy, where the reports can be available as early as 2 to 3 hours, so that our decision making in terms of choosing the right antibiotics can be started at the earliest to decrease the mortality. To sum it up, the tips for pneumonia prevention: when a patient having any symptoms of fever, cough, breathing difficulty, wearing a mask, keeping a social distancing is a need of the hour, and revisiting overcrowded areas, keep mask as a handy option. And at the same time, treat your underlying comorbids more efficiently. If you are a diabetic or hypertension, need to have a good control. Keep your environment clean as much as possible. And also one more, pulse oximeter comes up as an handy parameter to judge whether you need to rush to emergency for further care. All these things can be enumerated in Aster CMI Hospital and the Pulmonology department to get you more information. Thank you.